Okay, this is lab 3. I'm the examiner. I'm Imani. This is my patient.
This is Leah.
This is Leah. And okay, now we're going to perform 2 palpations. We're going to perform a palpation of the jugular notch, and we're going to perform a palpation of the greater tuberosity of the humerus. The jugular notch is going to be where the clavicle, both sides of the clavicle meet the manubrium or the sternum, and hers is here. And then for okay. So to find the greater tuberosity of her humerus, we can find her bicipital groove. We can find her bicipital groove by following her armpit. And it's here. Go over a little bit, and you should feel a bone of prominence. Now, to make sure that this is the greater tuberosity, we will have her rotate in and out. Rotate in and out for me.
Oh, to be
Yes,
faster.
yeah. And okay, this one. It's about here.
Hi, my name is Shelby, and this is Gabriel. He is my patient today. And first, we're going to be showing you the range of motion for shoulder flexion. So I'll have my patient lay supine, so on their back, with their head on this side of the bed so you don't hit anything. I will be lining the fulcrum up with the humeral head. So first finding that, which, yeah, you can see right here. I'll have them have their arm up at a 90-degree angle. Okay. Putting the movement arm, there we go. Movement arm up to the midline of their humerus, in line with the midline of their humerus. Stationary arm is going to be with their torso. And I'm going to ask the patient to bring their arm as far as they can up to or behind their head. So you can go ahead and do that. Keeping the movement arm in line. There we go. And we are at 172, which is within the range of motion, which is between 170 and 180. I will keep my patient on their back like this while we do shoulder abduction. This time, I will stand on this side of the patient just so I don't get in the way of them abducting their arm. So again, starting out, we'll already start out at 9, or close to 9, we'll see where that's at. Fulcrum is going to be on that humeral head as well. And then movement arm in line once again with the midline of the humerus. Stationary arm is going to be parallel with their sternum. And once again, I'm going to ask the patient to move their arm up by their head as far as they can. So you can go ahead and do that. And they are at 172 as well, which is in the range of motion between 150 and 180.
Okay, so now we're going to test for a range of motion for shoulder internal rotation. So I'm going to place my goniometer fulcrum at the olecranon process, which is here at her elbow, and I'm going to have the stationary arm toward her ulnar styloid. And, yeah. Her internal rotation measured 81 degrees, which is in the typical range of motion of 80 to 90.
So now I'll be palpating the superior angle of the scapula. So I'll have my patient sit short seat, sitting up straight, just so we can see everything clearly. And to get a better view, and to be able to feel better, I will move the tank top over. I will start by asking him to put his hand behind his back, which then helps pop out that inferior angle right here. And then we can feel the medial border. you can relax your arm. So now that we know where that is, we have a good feel of it. We'll then find the spine of the scapula, which is up here, and meeting those two together, you will be able to feel, and you can also have them put their hand behind their back again. You can do that. Yeah, and because then right here, if I were to go back up where that medial border is, then I'll be able to feel where it dips off into that superior angle.
So now we're going to do a manual muscle test of the pectoralis major. So what I'm going to have her do is flex her shoulder at 90 degrees and her elbow at 90 degrees. Make a fist. And so now I'm going to instruct her to resist against the motion of me pushing her back, and she will try to go against her body. Okay. 1, 2, 3. 1, 2, 3. And she is at a 5.
So now we will be doing the manual muscle test for the deltoids, specifically the middle fibers. I'm going to be standing kind of behind the patient just so I can have a better, position. I will ask my patient to bring their arm up, like abduct their arm out at a 90-degree angle, and then keep their arm, parallel to the ground. I will have a stationary arm on the shoulder just to stabilize, and then my other arm is going to be by the elbow, which will be pushing down. I will instruct my patient to keep their arm just where it's at. I'm going to be applying force and not to let me push down. Okay, keep it here, don't let me push down. And we're going to do it one more time with more force. Awesome, okay. And since we know that he was able to bring his arm up, we know he was already starting at a 3. I applied some pressure to make sure to see where he was at and to check that he was at a 4, and then twice to do more pressure to say that he was at a 5.
Now Leah will be performing an exercise on how to strengthen the latissimus dorsi. So she will be performing a bent over row with weight and without weight. In this motion, she will be pulling her arms down and back, which would be performing the action of shoulder extension and shoulder adduction. Go. So this is the bent over row with no weight, and she's going to grab the 5-pound kettlebell, and then the bent over row with weight.
Okay, now we'll be strengthening our deltoid, specifically our anterior fibers. So to do this without weight, I will have my patient, or I would instruct my patient to be lifting their arm up in front of them to a 90-degree angle, and then back down. And we would do about 3 sets of 10 of these, which we won't do right now. And then as you progress, or if you're doing that at home, you would find something that has some form of weight. We have a drill. So I would give that to the patient, and he would do the exact same exercise, just this time there would be weight with it as well. 3 sets of 10.
Okay, so now Leah will be performing a stretch of the latissimus dorsi. I'm going to have her grab the threshold. She's going to bend her knees, and then she's going to bend at the trunk a little bit, and she's going to pull away from the door. And in performing this motion, she's doing shoulder flexion and shoulder abduction by turning away, and she's stretching her latissimus dorsi.
So now we'll be stretching our anterior fibers of our deltoid. So I would have my patient sit on the floor, and what they'll be doing is keeping their feet flat on the floor. Their hands are going to be placed behind them with their fingers facing them. Then they'll slightly bend their elbows while leaning back, stretching all right here. You're gonna hold that for about a minute, do 2 to 3 times, making sure the elbows aren't flaring out and staying straight behind us, like that. Good job.